Dear students, I am Dr. Mohammed Shafee, Professor in the Department of Community Medicine at JIIU's IMSR, Badnapur, Jalna. In this video, we'll talk about the spotting in community medicine practical examination. So this is the pattern of exam. Total marks for community medicine practical exam are 100 marks, and there are 5 heads under which practical exam is conducted. Clinico-social case 20 marks, epidemiology and statistical exercise 20 marks, spotting 20 marks, skill assessment 20 marks, grand viva 20 marks. So in this video, we'll talk about the spotters or spotting, which carries 20 marks. And these are the sections from which spots will be asked to you. Number one is vaccination, number two is nutrition, number three is family planning, number four is entomology, number five is water, number six is biomedical waste management, number seven is mother and child healthcare, meteorological environment, insecticides, and some diagrams which are given in the book. So we'll talk about the point number 4 to 9 in this video. So first section is medical entomology. So entomology is nothing but the study of insects of medical importance. So all the insects which are transmitting the diseases are asked in medical entomology. So what are the types of questions asked? First question usually asked is identify with reasons. So here you have to describe the head, body of the insect and the legs. So identification features you have to write down. So identification is the first point. Then they may ask you about the life cycle, stages in life cycle, then diseases transmitted by this vector, whether it is a definitive host or intermediate host, then what are the breeding habits and how control is done of these insects or entomology. So now very importantly asked is Anopheles mosquito or Aedes mosquito. So when you describe, so you can see that there is an angle of 45 degrees made by Anopheles mosquito to the surface of the skin. Then head is clearly seen here, proboscis, antennae, then body, then legs. These you have to describe. Aedes mosquito, you will find white strips over the body and on the legs also. This is also called as tiger mosquito. And Aedes aegypti is the mosquito which is also asked very commonly. So they will ask you about the diseases transmitted, identification features, control measures. Then this is the Culex mosquito and this is Mansonia mosquito. So we have 4 types of mosquitoes which are asked in spotting. Number one is Anopheles, number two is Aedes, number three is Culex, and number four is Mansonia mosquito. So Mansonia usually not kept in the spotting, but Anopheles, Aedes, and Culex may be kept in the spotting. Then this is rat flea, which is a carrier of the plague, which sits on rats and transmits the plague. And this is sandfly. And lastly, in entomology is the housefly. So here also they ask about the mode of transmission by the housefly, like vomit drop, mechanical transmission, and then what is the mechanism by which houseflies they transmit the diseases to others, and what are the common diseases which are transmitted by housefly. Then insecticides, this also comes, it's related with the entomology. So in insecticides also, usually they keep the Paris green or DDT and pyrethrum. These are the 3 chemicals usually kept in insecticides. So you have to identify the type of insecticide. So for this, you need to know the classification of insecticides. Then mechanism of action, how this insecticide is killing the vector or the mosquito or housefly. Then we what are the insects which are killed and duration of action for how long? Like DDT is will act for almost 6 months. So how long is the reaction time or residual effect of the insecticide, and what are the adverse reactions caused due to the use of this insecticide, and if there is a poisoning by the farmers particularly. Then from the water, we have chloroscope, then we have Horrocks apparatus, slow sand filter, and rapid sand filter. Sometimes sanitary well, insanitary well, or also step well is also asked. So these are the spots from the water. So here they will ask you the steps in the filtration of the water, what type of layer is formed in slow sand filter, and what type of layer is formed in rapid sand filter. What is the washing method for slow sand filter, rapid sand filter? Then chlorination. In relation to chlorination, they may keep you chloroscope or Horrocks apparatus, and question asked is like define chlorination, define superchlorination. What is the use of chloroscope? What is the use of Horrocks apparatus? And on these spots, they may ask you to define breakpoint chlorination and what is residual chlorine. So such type of questions are asked on the water spots, and usually one spot is kept from the water. Then biomedical waste management, this is very important for theory point of view also and for the practical also, and in microbiology also they teach you. So first thing they will ask you about the various color codes which are used in biomedical waste management. Second, type of waste, what are the various types of waste and which waste is disposed of in which color coded bag. Then waste disposal, in that they have the steps like segregation, minimization, collection, disposal, transport, the all steps they may ask you. Then they may display this sign, is called as biohazard sign. You have to name this sign. And disinfection of the waste, like vomiters, or if there is a stool by diarrhea, how the disinfection will be done. Sometimes they ask you to define disinfection also. Then meteorological environment, these are the spots which are usually kept in meteorological environment. So we have globe thermometer, we have quarter thermometer, we have maximum and minimum thermometer. So maximum and minimum thermometer, then wind vane, we have the uh, anemometer, lux meter. This is maximum and minimum thermometer, and this is dry and wet thermometer. So this is dry thermometer and this is wet thermometer. Uh, there is a cloth here which is made wet, and ceiling cyclometer. So these are the various pots which are kept from the meteorological environment. So we have globe thermometer, we have Carta thermometer, we have dry and wet bulk thermometer or hygrometer. Then we have maximum and minimum thermometer, lux meter, anemometer, and wind vane, and lastly sling cyclometer. So here also they will ask identify and uses of the thermometers. Sometimes they may ask you heat indices on thermometers also. In mother and child health, usually they keep the growth chart. Sometimes growth chart from WHO is kept where you will find two curves only, and there is a green area in between those two curves, and that area is called as a road to health. Then sometimes they may keep you iron and folic acid tablets. They may keep 5 clinics of delivery, immunization schedule, growth chart, Apgar scoring, Shaki step is usually kept to assess the mid-arm, upper arm circumference of the child between 1 to 5 years of age. So these are all the spots from mother and child health which are usually kept in your exam. And lastly, these are some diagrams which are given in your like most common diagram asked is iceberg phenomenon, then spot map by John Snow, then web of causation. This is management techniques like program evaluation review technique and critical pathway method. Epidemiology, tried. So these are all the various pictures which are given in the book. They may ask you this picture, and they will ask the questions on those pictures. So like this, you have to prepare for your spotting, tick out the important spots and read important points for them so that it will be easy for you to write in your spotting examination. So there are 20 marks for the spotting. Some people keep 10 spots for 2 marks each, or some people keep 4 spots of 5 marks each, or some people they keep 5 spots of 4 marks each. So like this, spotting is done in case of chemical medicine practical examination. So I wish you all the best for your exam. Please read the questions carefully and then write the answers for each spot. So thank you very much for watching this video till end. I request you, all of you, please subscribe my channel, like my videos and share in your friend circle. Thank you very much.